Every day, patients are asking their dentist questions such as, how long will this filling last? Why is my gum disease not getting better? Or, should I have an implant or a bridge? Patients and practitioners need answers to these and other questions during daily clinical care. There are many more questions than we can answer using traditional clinical research studies. Therefore, we need to look for new ways to gain insights into how we can best improve oral health. One resource for answering these questions are data from clinical dental care. Today, many dentists are using electronic dental records for recording these data. Dentists are entering information such as treatment procedures, findings, and progress notes every day. But most dentists aren't using the data in their electronic dental records to answer clinical questions. Several studies have shown that data in electronic dental records can help answer questions arising during clinical care. For instance, to determine whether the difference in restoration longevity between amalgam and composite restorations depends on a patient's caries history, a study can use data such as restoration type, date of placement, and history of caries lesions. If these data are stored in the electronic dental record, the relevant variables can be extracted and analyzed. However, data that look perfectly understandable on the screen are often difficult to extract electronically. So, what should dentists interested in answering clinical questions do? One option is to pair up with a clinical researcher. However, a clinical researcher cannot do the job alone either. Typically, the researcher works with a data manager to analyze data from clinical records. The researcher provides the data manager with a description of the data he needs for the study. The data manager writes complex custom queries to extract data from the database and sends the results to the researcher for approval. This process often involves trial and error and must be repeated to produce the exact data needed. This is cumbersome and time-consuming. Worst of all, the whole process starts over when a new question involving different variables is asked. At the University of Pittsburgh Center for Dental Informatics, we are developing a new method to leverage data from electronic dental records for quality assurance and research. Our partners include the State University of New York at Buffalo and Oregon Health and Science University. Our method begins with extracting data from an electronic dental record system using the Oral Health and Diseases Ontology, or OHD. The OHD is a novel framework for representing clinical data in a structured format. Once imported into the OHD, clinical data are checked for quality and consistency as well as classified. Data can be exported in a number of formats for statistical analysis. Even better, our method is highly reproducible and can be used to integrate data from many different electronic dental record systems. As a result, overall effort in answering research questions from clinical data is reduced because each electronic dental record system only needs to be connected to the OHD. From there, processing is the same for all data, regardless of the source. This makes it possible to get more valid answer from a larger data pool. So, did this short description of our project get you interested in our method for learning new things from clinical data? If you want to learn more, please visit our project website, shown at the end of the video. If you are a researcher, we would love to hear from you about the kinds of questions you're trying to answer from clinical data. If you're a practitioner, please consider donating a de-identified copy of your patient database to our project. In any case, we look forward to hearing from you.